Hello, it's me once again. Well, today we are looking at waiting times. Wow. That is something to really think about because you can wait and wait and wait and wait. But now, from the patient's point of view, you nurses, you know what you're waiting for, but the patient doesn't know. So they start getting agitated. They start thinking about all the things they could have been doing. You know, oh my days, it's just taking so long, forever. And they see some people who came after them, seen, gone, and they're still waiting. They're like, what? What is going on? So what should you do? Reassure your patients. Just tell them what's going on. Inform them, but we're still waiting for this and this. That is why. And you as patients know that everybody's case is different. Maybe this person just came for a jab. Maybe this person just came for a follow-up. You are a new case, you're going to take longer. So don't compare your case with the other patient. Don't compare your waiting times with the other patient. This just a side note for the patient. But as nurses, do inform your patients. Tell them what is happening so that they do not in the dark and their mind is not racing to all the news they're hearing from the nursing station. Tell your patients what's happening. You have a TV in the waiting room. Keep it on. Don't be obsessive with the cleaning. The cleaning can wait. If it's clean and there's no obvious date, the cleaning can wait until all the patients have left. The cleaning can wait. Let the patients know that they're valuable. Remember to give full treatment to your patients. After they've been waiting all that while, now you rush the treatment because it's time to go home, because of this and this and that. Don't do that. Don't rush any processes because it's near home time. Remember, nursing is a 24-hour service. Hand over your patient and ensure they are well looked after. And only discharge after the full treatment has been given. Better an alive patient than one who gets home and dies just because you wanted to tie loose ends before the end of your shift. That is a no. My challenge to you as a nurse is go to a hospital, just sit in the waiting area, see what's happening, observe what's happening at the nurse station. Just see, accompany someone, or just go through the process so that you get an idea of what I'm talking about. Because if you've never been through the process, you won't understand it. I recently saw these nurses who were being made to wear in these contorted outfits so that they would understand what it is to be old. Walking, eating, because when you have been in those shoes, it is easier to now understand what is going on. If you have never been in the shoes, you can never really understand. So I'm challenging you. Go in the waiting room. Assess. Not in the hospital you work, no. At a different hospital. Because at the hospital where you work, they will treat you nicely. Because they know you. Go somewhere where they don't know you. Just observe. Be a stranger. That's the best scenario. When you are observing, watching, and nobody, you get the full picture of what I'm talking about. You will now finally see, feel, and experience what the patient feels when they visit a hospital. I dare you to give it a go, and you will be surprised about the things you will see from the patient's point of view. that is it. Was quite short and straightforward. I'll see you in the next module, and do let me know how you get on your trip to your investigations. Yeah, that will be a good learning curve. That will be a good learning curve. Find it out. Let me know how you get on. Yeah.